You may think you're the only person who has to sleep around someone who snores. It's been estimated that between 30 and 50% of adults snore while sleeping. Listen to this obnoxious and annoying challenge. Do you like that sound? Would you like to sleep around it all night? I doubt it. The percentage of snorers is reported to increase with age, and men snore more than women. A related problem, sleep apnea, or so-called obstructive sleep apnea, where the breathing space in the back of the throat is closed off. It causes significant pauses in breathing while sleeping, affects an estimated 18 million Americans, and I'm sure it's similar in other countries, and it can be life-threatening if it's left untreated over time. So 2 problems, snoring and sleep apnea. You may not know that many dentists are involved with treatment of both conditions. A survey of our research group showed that over half of the dentists who responded were treating snoring, and that's increasing. It is well known that a team approach is necessary to diagnose and treat these conditions to provide peaceful and safe sleep. Snoring causes sleep deprivation, psychological damage, marital challenges, and an increased potential for heart attack and stroke. Dentists are one of the primary practitioners treating snoring. Although the topic is getting more attention in the lay press, many people do not know that there is professional help for snoring. When treating snoring, dentists also work with sleep technicians, dental laboratories, and board-certified sleep physicians as a team. That's important. This presentation shows the causes of snoring and provides information to help you overcome this challenge. There are many causes of snoring, and you or someone you know probably has one or more of the potential causes listed on the following image. Some of the causes of snoring are obstruction of the nasal airway, weak throat muscles causing the throat to relax and get narrower during sleep, the soft tissue relationship caused by the lower jaw being too far backward. As it is, it closes off the throat. Using muscle relaxants such as alcohol or sedative hypnotics. Sleeping on your back causes the tongue to drop back into the throat and causes that sound that you have well identified as a snore. Fat accumulating in and around the throat. Many obese people snore. Loss of airway muscle tone as a part of aging. Everything sags. The percentage of snorers is reported to increase with age. I don't have to emphasize to you how disruptive snoring is to anyone sleeping in the environment of a snorer. Partial or total closure of the airway by which you breathe is the normal cause of snoring. Notice the top image and you'll see that the airway is open. Look at the second one down and you'll see it's partially closed, and that causes that vibration of those 2 pieces of soft tissue as they vibrate together when you're trying to breathe. And look at the bottom one. That is obstructive sleep apnea. That person cannot breathe at this particular point, and therefore it is a life-threatening condition. For most people who snore, the condition can be reduced or eliminated relatively easily, but there's a commonly occurring complication that some of you know. This other condition associated with snoring that deserves our attention is called sleep apnea, or pauses in breathing. What is it? Sleep apnea, or pauses in breathing while sleeping, in both adults and children ranges from 5 to 30 times per hour and causes daytime fatigue, slow reaction time, and vision problems. It's been estimated that about 1 in every 15 Americans is affected by at least moderate sleep apnea, which can cause numerous serious physical challenges. If the airway is blocked, the person cannot breathe and breathing stops. How about that? You need air. This is a very serious, life-threatening condition. Many people have sleep apnea and they do not know they have the condition. We've identified in my practice some who could have died had we not found the sleep apnea present and got them into a person who could treat that part of this sleep challenge. Sleep apnea is closely related to snoring and must be analyzed when attempting to eliminate snoring. Obstructive sleep apnea is the most common type of sleep apnea. It occurs when the soft tissue in the back of the throat relaxes during sleep and blocks the airway. Can you realize if you were sleeping on your back that the tongue would go back, block that airway off, and you're not breathing? That situation interferes with normal breathing and often causes very loud snoring. Central sleep apnea is a much less common type of sleep apnea. It occurs when the nervous system fails to signal the muscles that control breathing. Complex sleep apnea is a combination of both the throat closing off and the mind saying, don't breathe. It's often associated with very significant medical problems. As you can see, we need a team here, don't we? All forms of sleep apnea often go unnoticed and can become very serious when left untreated over time. It's much like smoking cigarettes, in that it's not the first cigarette that's dangerous, it's smoking over time. Similar is true with sleep apnea. There are numerous concepts related to reduce or eliminate snoring. However, use of a CPAP, which is a continuous positive airway pressure device, and oral appliances are the most used and by far the most successful treatments. Most authorities agree that it's important to measure if you have sleep apnea, and if so, how severe it is before initiating treatment for snoring. Some dentists use home sleep testing devices to determine the presence and severity of sleep apnea. You wear a device such as this for 2 or 3 nights, and the dentist and sleep physician consult on the presence of sleep apnea. Other dentists may send you to a sleep clinic to determine the sleep apnea severity. Assuming your sleep apnea is not severe, oral appliances can easily be used to stop snoring. CPAP, a continuous positive airway pressure, can stop snoring and reduce sleep apnea. However, it's been well researched that 40 to 60% of patients placed on a CPAP do not like this solution to snoring. Oral appliances have far better compliance than CPAPs. The most commonly used oral appliance moves the lower jaw forward up to 75% of the maximum forward movement. You try to move your jaw forward, you can go about a ½ inch forward. This opens the airway. You don't have to go all the way forward. The dentist would get it to the point where you quit snoring and stop right there with this appliance. There are various other methods to reduce or eliminate the influence of the tongue in restricting the airway. One of the other ways is to wear a device that pulls your tongue forward, therefore opening the airway. And the other one is an appliance placed on your lower jaw that has a little finger going down, holding the tongue forward. Some of the side effects in about 1 of 3 patients have been shown to be jaw or facial muscle pain, bite changes, tooth pain, jaw joint pain, drooling, and dry mouth. Now, they're not very pleasant kinds of things, but they don't happen that much. What have I really said? Stay the way you are. Keep trumpeting. I don't think you want to do that. Go to a dentist and have that dentist do a sleep test for you and determine if sleep appliance is appropriate for your particular condition. If it's not, that dentist will refer you to a person who can handle your sleep apnea, which is apparently too severe to put a sleep appliance in. What are the advantages of each of the major methods? The CPAP has advantages because it is very effective. But what is the bottom side of that? 40 to 60% can't wear it. And what about the advantage of the oral appliances? They're very, very well accepted overall. You heard a few negatives. The disadvantages are the side effects that occasionally occur that we've discussed. The costs of each vary enormously. It depends on how long it takes to treat you, but generally speaking, the cost is very insignificant compared to the desirability of getting rid of the snoring. Are there risks? You heard that slightly. When you move the jaw forward, you can have some challenges in the joints and muscles. But again, this can be controlled. If there is a challenge, you move to another type of appliance. What happens if you do nothing? You just keep snoring, and you don't want to do that. Snoring is not only a highly disagreeable condition. When combined with sleep apnea, these conditions can contribute to ineffective work and potentially accidents. Your dental professional can provide information for you and potentially very effective treatment to stop snoring and reduce or eliminate minor sleep apnea. If it's major sleep apnea, you're referred to a board-certified sleep physician and they take over that part of your problem. Yes, sound, peaceful sleep is possible.